How would you feel if at your next appointment your doctor walked in and said, "I'm sorry, there's nothing else I can do for you"? That the treatment that you have been receiving for your disease or illness is no longer helpful. That the treatment risks now outweighed its benefits, or simply, there just isn't a cure. Approximately 1 million people are diagnosed each year in the United States with a terminal illness, meaning that 1 million people are told each year, "I'm sorry, there is no adequate treatment or cure for your disease." Sadly, only a small portion of these people will choose to receive hospice services. Today, I hope to explain to you what hospice is and explain some of the services that it provides. I've been a hospice nurse for almost 5 years now, and I've taken care of many patients with illnesses and diseases ranging from an unexpected brain bleed due to a fall to end-stage diseases such as congestive heart failure, renal disease, and cirrhosis, to the most well-known form of terminal illness, cancer, and its many faces. Merriam-Webster defines hospice as a facility or program designed to provide a caring environment for meeting the physical and emotional needs of the terminally ill. The National Hospice and Palliative Care Organization, otherwise known as the NHPCO, states that hospice care is considered the model for quality, compassionate care for people facing a life-limiting illness. Hospice provides expert medical care, pain management, and emotional and spiritual support expressly tailored to the patient's needs and wishes. The purpose of hospice is to promote comfort in the patient, to help control pain and other symptoms that may appear during their disease process. Also to provide emotional and spiritual support, not only to the patient, but to their family. Hospice first became known in 1948 when Dame Cicely Saunders, a physician, organized specialized care for dying patients. She later went on to develop the first modern-day hospice named St. Christopher's Hospice, and it is located outside of London. Saunders introduced hospice to the United States during a lecture to medical students, nurses, social workers, and other healthcare professionals at Yale University in 1963. And during her lecture, she discussed the dramatic differences in before and after symptom control care in patients with terminal cancer diagnosis. This lecture then spawned a whole variety of events that helped to create hospice as we know it today. Hospice can be provided in several settings. First off, hospice is initially geared to be provided in the home, where the patient can stay surrounded by things that are familiar to them and surrounded by their loved ones and family members. Other areas that hospice is provided in are inpatient hospice settings. These are facilities that provide more extensive hospice care, the more extensive symptom management when things are out of control. Hospice services can also be provided in some hospitals and long-term care facilities when contracts are available. When you're admitted to hospice, there is a multitude of services that can be provided to you. First off, nursing. And basing this off being provided services in the home, nurses can come out several times a week. They will be monitoring your vital signs, monitoring your medications, following up with how your disease is progressing. They can follow up with your doctors if order changes are needed, and also just take care of everyday things. Hospice aides are also available to help you with your personal care. Things like baths and bed linen changes. Social workers are also available to not only help the patient with their emotional support, but to help the family with any issues that need to be taken care of, such as advance directives or end-of-life planning. Chaplains are also available. They can work alongside your own personal chaplain, or they can solely help you with your spiritual support. One of the greatest services that is available through hospice is volunteer services. Volunteers are able to go out and read to the patient, go out and play games with the patient, or simply just sit and listen. Also, one final service that's offered by hospice is bereavement. Now, this service is more for the family after the patient's passing. Bereavement will follow the family for up to a year, to be available for counseling during the grieving process, and just kind of follows and makes sure things are going on as they should, that you're able to cope with your loved one's death. To reiterate what I said earlier, approximately 1 million people are diagnosed with a terminal illness each year. And only a small portion of these people elect hospice services. Most of the time, these 1 million people will lose hope during this time. Lose hope of living, lose hope of having any sort of normal life any longer. Hospice is there to help with that. Hospice is there to redirect hope, to redirect the focus of what's left of their life. Hospice is there to help create a comfortable environment to where the patient can be happy and enjoy their life. Sadly, still only a small portion of these people choose hospice.